Amanda Merritt, and my desire to help children and families in a healthcare setting started with my own childhood medical journey. I feel like Child Life is the best way that I can support children and families through their own medical experiences and come out the other side with as little trauma and as many coping skills as possible. And every child deserves this so that they do not fear healthcare settings. I like that Child Life is rooted in evidence based practice and developmental theory, and that no 2 days are the same. To be a child life specialist, you have to be adaptable and think on your feet, and it's also fast paced. If I was to prepare a 5-year-old in the emergency department for an IV, I would first explain to them that an IV is just a bendy straw that goes in your arm so that the doctors and nurses can give you the medicine that you need to get better. To place your IV, the nurse is first going to put a big rubber band around your arm to give it a tight hug. She'll then feel for the right space to put the IV and then use a small little wipe that might feel a little cool to clean your arm. Next, they'll use a tiny little needle. Don't worry, I promise it won't stay in your arm, to place the IV. It might sting for a minute, but it'll only last for 1, 2, 3. Then they'll remove the needle, leaving behind just the little bendy straw, and they'll place tape and band-aids over it so that you can still move and bend your arm. And that's it. It's all done. My most valuable medical experience would have to be when I worked as an activities of daily living specialist, and I worked with this little boy who was 3 and had lived in the hospital his whole life. When he entered our hospital, he was on a trach, vent, and was not able to walk on his own. I only worked with him for 3 months, but I worked with him every day for about 2 hours to get some of his therapies done. A couple months into working with him, I got to see him discharge. On that day, he walked out of the hospital holding his mom's hand under his own power and not on a ventilator. And this was one of those moments where I realized when everyone asks me why I do the job I do, or why I want to do the job that I want to do, that this is why. These are the moments we're there to help kids through these journeys so they can come out the other side, so they can do things no one ever thought they would be able to do, and they hopefully don't fear medical settings anymore. The value of play in a hospital setting. It gives a sense of normalization. It can help a child life specialist assess the child. It can prepare children for procedures, and it is an excellent distraction tool. If I could be any distraction tool, it would be bubbles. When you play with bubbles, you can't help but smile, and they also can overcome. Even when it seems like they are broken, the wand still works and you can still blow bubbles, and that is something I am proud to be like.